going to dive into a little bit of a self-assessment. Shay's going to walk in here and we'll look at a couple of things that we usually want to look at. And these might give you a bit of an idea as to, okay, is that a problem for me? Is that something I should be working on? But again, we're going to mainly be addressing how my foot or ankle move, how I can use my knee in certain movements or ranges, what and where do I feel this? Okay? So Shay's going to come on in. So the first thing we're going to talk about is passive range of motion. So how can I move that knee on my own or without using it actively? So I'm going to pull this guy over, and Shay's going to have his feet just facing this way. Good. I'm going to have you just kind of scooch back a little bit, Shay, or sort of lean back. And what I want you to do is just grab your leg and pull your heel all the way into your butt. So give that a great big bend and tuck it in. And what we're thinking here is, does this hurt? Where does this hurt? Is this the pain that I get? What do I feel here? And then also, how close is that heel to getting to my butt? And then she's going to try it on the other side. And what I want to think about is this the same on both sides? Do I feel this more on one side than the other? Does the side that hurt, is it not moving as much? Does this feel good? Is this relieving my pain? And then the next one is extension, that is what we call flexion. So she's going to put her leg out in front of her straight like this. And she's going to put her heel on the ground, kind of lean her body over it. And she's just going to give a little bit of pressure over that knee, pushing it into a little bit of extra extension. Does this create her knee pain? Does this relieve her knee pain? Does this feel stuck? Does this feel the same as the other one? Do they both go as far? Does one of them not extend the same? What do you feel? The next one is rotation. I mentioned how important that is. That's going to be more of an active, so we'll start with that. So she's going to sit with her knees bent to 90. She's going to bring her toe up, but her heel stays on the ground. And holding her thigh, she's going to turn her foot all the way in. Good. And keep turning, turning, turning. So her thigh is not moving. Her foot is turning. Her shin is turning. She's going to think, where do I feel this? What does it feel like? Does this hurt? Does it look like it moves a lot? And then she's going to keep her thigh nice and still and turn the foot out. What do I feel with this? How far does it go? Does this feel good, bad? Is this my pain? Then we check the other foot. So what she's doing is thigh is still, turning the shin all the way in. If you look at the bone kind of right down the front, turning the shin all the way out. Does this feel the same on both sides? You can think about measuring it if you want. You can probably just sort of eyeball it and think, okay, how many degrees is that? Is this the same one side to the other? Okay? The next piece is going to be my active ranges of motion as well as this one, so she's going to stand up. And we want to think about flexing. So she could pull her heel all the way to her butt if she used her hand. Can her muscles do this? She's going to stand up and bring her heel as high as it can come. Okay? So actively, she can get just over 90 degrees. Passively, she can get that sucker right up there. Is this the same on both sides? Does this create your pain? Does this feel bad, feel good, feel shaky? Does it cramp? Does it feel weak? Something to keep in mind. Is one side worse than the other? Okay, and then the last one is our active extension. So she's just going to squeeze her quad, pushing her knee back as far as she can. She'll feel all these muscles squeezing. And then the other side, same thing. Squeezing, squeezing, squeezing. Feeling all those muscles to the front. Does this feel harder? Does it feel easy? Does it feel like it actually works? What do you notice with this? Does this create your pain? Does that make pain under the kneecap? That kind of thing. Okay? So we've got how much does the knee move when I use my hands to do it or passively? How much does my knee move when I do it actively using my muscles? Next one is a one-legged stance. This is best if you're in bare feet if you want to try it. Shay's got shoes on, no sweat. What she's going to do is hands on her hips. She's going to bring one knee all the way up to 90. And we're going to hold here for a little bit. And if you're doing this with us, I want you to think, what do I feel? Do I feel sturdy? Does this feel easy? Could I hold this all day? Is there pain? If you're moving a little bit, what you're going to notice is it's probably your foot that's doing the most moving. So if I'm having an issue with this, if this is super hard on one side, I'm wiggling all over the place, I probably need to increase some stability in my foot and my ankle. And let's try the other side. And again, what I want you to think about, is this the same on both sides? Is one side super hard? Is one side way too easy? Is one side super tired? Do you feel the hip getting really tired? Is the other leg getting really tired? Is the ankle wobbling all over? Because if I'm having pain in running or walking or doing something repeatedly, this is going to play a big role. After 20,000 steps, you better believe that's going to take a toll on some of those other tissues. So again, I may not be overusing it by doing that run. I may be misusing it because now it's got to accommodate for all that wobbliness that's going on with my foot and ankle. Okay? So it's our one-footed stance. The next is a one-legged squat to a box. You can do this just to your chair, just to your couch or your kitchen chair. What she is going to do is hands on her hips, one foot out in front like this, and she's just going to sit back until her bum touches the table or the chair, and then she's going to come back up. And what we're looking for here is this wobbling. Okay, so I'm going to move this out of it so you guys can see. You might not be able to see the black pants, and that's okay. I want you to face them there, Shay. And go ahead again. Can she do this slowly? Can she do this with control? Is her knee going all over the place? Is this painful? Is this easy? Does this feel weak? If this doesn't feel like anything crazy, do them until it feels tired. Right? I'm not going all the way down, I'm just going on my chair. Try 10 or 20, and then see what happens. Does it feel worse? Does it get harder? Does it get painful? Okay? How do those structures, how does that kinetic chain fatigue as I do this movement? Because again, if I'm having an issue with something like walking, jogging, running, sprinting, hiking, I got to do this a lot. I'm on one foot that whole time. So that's a pretty important thing. So it's our one leg squat to box or squat to a chair. Really excellent rehab exercise for running as well. It's not one of our strength exercises yet, but it is something that could be a good progression. Two more of our kind of self-assessments. The next one is called a knee to wall. So she's going to pretend this box is a wall. If it was a taller wall, she could put her hands on it, kind of like this position, like I'm in here. What she's going to do is put one foot back behind her for a bit of stability. And she's going to keep her heel and foot on the ground and start to bend that knee towards the wall until two things, either the knee touches the wall or the heel lifts off the floor. If the heel lifts off the floor, nudge your foot forward until you find a point where you can just touch the wall while keeping your foot on the ground. Once you've found that point, put your other foot at that exact same spot. So go ahead, Shay, put it there. Put the other foot back behind you now, the one that you were just moving. And again, try the other leg. Is this the same? Is this significantly harder? Is it significantly easier? Okay, this is how we see how does my ankle control my knee. And you'll notice her knee is taking a lot of force there. It's moving. But it is her ankle that is doing the most movement here and limiting that movement. So if my ankle cannot move well, I'm going to be loading that knee and hip significantly more frequently than if that ankle can share the load. Okay, think about the kinetic chain. Easiest way to put it is many hands make light work. So make your neighbors do their part, okay? So that is our knee to wall to just see how my ankles may be contributing as far as stiffness in my knee pain. And my one-footed stance was looking at how my ankle stability may be playing. The last one of our self-assessment is what we call palpate. Touch it. Poke it and prod it. Can you feel where your knee pain is? Is it sore to touch? When you poke it, do you say, ow, that's my knee pain, ow? The good thing about that is that's not on the inside of your knee joint because you can't get your fingers in there. So now you can think, okay, what structure is this? What am I touching? Am I touching a muscle? Am I touching a this? Am I touching a tendon? Am I touching a ligament? What am I touching? So we need to know the why, and then this tells us a little bit more about the why. Okay? Those are all important things. If you see a therapist or a professional, they're probably going to run through a couple of those different things with you to try to figure out what exactly might be going on with you or me if you're having an issue. So we're going to get into our exercises now. We're going to start with some stretches. Then we're going to do some what we call mobilizations, and we'll probably try a little bit of foam rolling. I'm not the hugest fan of it, but in these cases it's going to be really effective for relieving pain. And then we're going to look at our strength exercises. So the first one is for the quadricep. It is called a couch stretch. This is with pillows. She's going to pop this on the ground. She's going to put one foot up on the box. In this case, that's going to represent your couch. So your foot goes on the edge of the couch, and you drop that knee down onto a series of pillows, something nice and cushiony. If your knee does not tolerate being put pressure on at all in that way, you can hang onto the wall and just bring that heel towards your bum. Feeling that stretch all through the front of that thigh and a little bit of the front of the hip. What I want you to focus on, the main thing in this stretch, is just squeeze your bum. That's it. If I'm very tight here, it's going to stop me from being able to use this. So no matter where I get that heel to, I want to try to squeeze my bum. It's going to ramp that stretch up. You don't have to stretch the snot out of this. Keep it mild and comfortable, but make sure you can squeeze your glute in that position. Our next stretch is for the muscles on the inside of the thigh. We call it a rock back. If you're here for our hip workshop, you'll recognize this. With a pillow under one foot, under one knee, you're going to stick out the other leg straight to the side. Toes facing forward, hands on the ground. Keeping a nice flat back position, Shay's going to rock back towards her heels. As she does this, she's going to feel a really big stretch right into the inside of the thigh, possibly right into the inside of that knee. If your knee pain is right here, I can tell you that this may aggravate, and it might possibly relieve as you do it. You'll notice she's not hanging out in this stretch for a significantly long period of time. She goes there, feels the stretch, backs off. Goes there, feels the stretch, backs off. When we do this, we're looking at about 10 to 20 repetitions. You should notice as you do it, it gets a little easier. And we're doing this on both sides. And this is a very frequent, as often as you need, kind of stretch to keep the hip and knee mobile and moving well. Okay? The next one is our hamstring. I'm a big fan of doing the hamstring stretch standing. You can also do it laying on your back with a band or a towel. If I'm going to do it laying on my back, it's because I'm tired and I'm just hanging out. What we're going to do is use a chair or a box. So Shay's going to come back over towards this box. And what she's going to do is stick out her tail. So she arches her back a little bit. And she's going to bend her knee slightly. Good. If you feel your hamstring stretch only in the back of your knee, you are just feeling pull of that tibial nerve. Because the hamstring muscles are here. I want to feel this stretch somewhere in the middle to upper back of my thigh. So by bending that knee, you can take a bit of tension off of that nervous tissue and really let that stretch come up a bit higher, which is probably what Shay's feeling now. 30 seconds is a decent minimum. I like to go a bit longer. It really depends on you or how stiff or tight you are in here. But again, she's got a nice straight back position, a little bit of bend in the knee. If you're doing the same laying on your back, it's the same kind of thing you want to keep in mind, a little bit of bend in that knee. For females, oftentimes you guys are quite a bit more mobile here. Just because we're more mobile doesn't mean we want to really reef and pull that stretch. The stretch is behind your knee. You have to bend the knee, okay? The next one, the last stretch, is our calf stretch. Our knee to wall is a pretty decent way to do that. However, my favorite is on your steps. So your first step on your staircase or any kind of object like this, what Shay's going to do is just put her toes up on that step and let her heel drop back off of there until she feels a stretch to the back of the knee. Now, because she doesn't have a railing to hang on to, she's going to put one foot forward here and just use one foot. If you're on your stairs, you can hang on and go both feet. Please do this from the first stair at the bottom, not at the top. But pretty simple. She's feeling that all up the back of that lower leg. This is a pretty tight one for a lot of people. Really helpful to improve some of the range of motion in the ankle and decrease some of that discomfort. Again, if I have pain in the front of my knee, or I mentioned that fat pad issue, a lot of the times if we open up a bit of movement or lengthen the calf, it's going to let us straighten that knee better with less irritation. Pretty simple stretch, can be really effective. We're going to look at our mobilizations, but before we do these stretches, you're going to notice that our strength exercises are just these stretches, but loaded with some slow movement. So very, very important. Again, minimal equipment, but very effective. So what Shay is going to do for our mobilizations, the first one we already sort of did was that knee to wall assessment. So Shay's going to find her wall. She's got her hands on the wall if there's an actual wall instead of a block. She's going to lunge forward, feeling that stretch in the back of the ankle, and then back off. And you're going to repeat this 10 to 20 times. And all you're doing here is just moving that ankle joint, moving that fluid inside that ankle joint, lubricating that ankle joint surface. If you got stiff ankles, or if you did this test and you were like, wow, that side doesn't move, this is a really, really big one for you. You got to be doing this very often. Okay, lots of movement, lots of mobilization, just repeatedly moving and bending that ankle. Again, I like this with a wall because I can rest so that I don't have to be holding that lunge position quite so strongly. Okay? This one's one of my favorites. We're going to do it seated. I'm going to pull this out a little bit. Or you can sit flat on your bum. This is a slow joint circle. We call it a controlled articular rotation. That's a fancy way to say slow controlled joint circle. But you might say my knee doesn't move in a circle, but it does. We already talked about that rotation. So what she's going to do is lift her thigh up, and the closer she tucks this to her body, the harder this is going to be, but possibly the more effective. You'll know why as soon as you do it. First thing she's going to do is pull her heel to her bum actively, as tight as she can. From there, she's going to turn her foot inwards, so the whole shin turns in. She's going to keep this inwards as she straightens the leg again. She's going to feel all kinds of tension in the back of this hamstring now. She's keeping that foot turned in towards me. Now she's going to turn that out and then tuck that leg back in, pulling the heel towards her bum. So it's a full circle. Toe comes one direction and bends, other direction and out. Okay? She'll do between 5 and 10 of these in one way, and then switch and go the opposite. So if you did that rotation test and you found you couldn't move, you could not rotate your knee at all, it just didn't seem right, or it was painful, this is when you got to be working. If you have knee pain at all, or if you care about the function of your knee or the health of your knee joint long term, very easy. All we're doing here is just moving the knee joint fully. Very simple. Okay? The last one of our mobilizations is called a flexion gapping. So we're flexing the knee joint. What she's going to do here is use a rolled up towel. So she's going to roll that sucker up. She's going to tuck it in behind her knee. Good. And then she's going to grab her shin. So if you're sitting on the floor, this might be easier. And now she's going to pull her heel to her bum. The lower she holds on the leg, or the closer to her foot, the better. The towel gives a little bit of a lever to open up and gap that knee joint around. You can use a harder object, but you're probably not going to like that it digs into some of the sensitive stuff back there. When we do this with a patient or a client, we might use our forearm in there and do it, but we're just wedging something in there and gapping around it. It's a really nice way to open up the front of that knee joint. So if during the assessment you had a lot of pain when you brought your heel all the way back to your butt, this guy's something for you, okay? If your knees are stiff and achy, this is something for you. You'll notice she brings it back, she gives it some pulses, lets it off a little bit. Brings it back, gives it some pulses, lets it off a little bit. All right, and she repeats that. And we're going to do this honestly between 2 and 3 minutes. And we're seriously going to do this for quite a bit of time, and you'll notice afterwards that knee just feels like butter. Really, really loose and ready to go, okay? So flexion gapping. Again, we are going to have these things with some decent pictures and in the handout for you guys. And again, this will be available on YouTube. We are going to do a bit of foam rolling. I hate foam rolling personally because it hurts, but it can be really effective, and these are 2 areas that it can be really helpful for our vague or general knee pain. Really, really good one. Shay's going to grab a foam roll. If you don't have a foam roll, that's okay. These aren't a necessity, but they can be a really good way. So the first thing she's going to do, we are going to target the outside musculature of the quadricep and the thigh. if I am stiff or I'm not moving well through my hips or I'm weak or I have weakness in my hips, a lot of the time that's going to transfer to a lot of increased tightness down through this region. Right into the top of my kneecap, right into the outside of my leg. Good. You'll notice here she's got her bottom leg with the outside of her leg down on the roll. The other leg has the foot on the ground for a bit of stability. I hope you guys can see that there. And she's got her hands on the floor. And what she's going to do, she's not just going to roll like she's rolling bread dough. What she's going to do is find the tender spot and take a little bit of time there. Maybe wiggle a little bit back and forth at the tender spot, but just work it a little so that she can gently breathe and relax. As that tender spot feels better, she's going to work her way down further, right towards this kind of top outside of the knee. What you're working on is a band of tissue, really tight tissue called your iliotibial band. All that means is my pelvis to shin band. This is my ilium, that's my tibia, my iliotibial band, okay? And the iliotibial band is basically a leather belt attaching your glute or your bum or your hip to the outside of your shin. It just gives you a little bit better leverage in movements like that. So if I'm dealing with weakness or tightness in my hips and I have a lot of pain on the outside or top of my knee, there's a big chance that working through this a little bit may be really great at relieving that knee pain. Okay, so this is more about relief, it's not going to fix. You'll notice she's done there because that's really uncomfortable for her. Pretty common, that's one of the reasons why I'm not a huge fan. If this is helpful and you're like, wow, that takes my knee pain away, we need to strengthen the hips, the glutes, the knee, and the ankle. So it doesn't change the approach or what also needs to be done, but it could be a really great way to just zap that pain and take it away. The next one, this is probably more important if your knee pain is on the inside of your knee. She's going to work through the inside of her thigh here. So she's going to lay face down, and the roller is going to be parallel to her body. Good. She's going to take the leg that she's working on and bend the knee and bring it up onto the roller. Good. And then straighten this one out. Good. And reach this one out to the side. Awesome. So what she's doing here is rolling this way up those thigh muscles towards the groin. Same principle. If you find a spot and you're like, ooh, wow, that's really sensitive, don't just skim over it and keep coming back. Stay there. Breathe, do a little bit of rolling back and forth, a little bit of edging with it. You'll notice it starts to really decrease. Okay, so a little rocking on the grumpy spot. Spend about 20 seconds, maybe a minute maximum on one spot. Work your way up or down from that area. Really effective, really helpful way to take away some of that inside knee pain. And you may notice when you did the foot rolling on either of these, you might hit a specific spot, way up here or over here, and it created your pain down there. Or you hit it over here and it created your pain down there. We call that a trigger point. It's really just a really sensitive point in a tissue. Likely it's an area where the nerve kind of comes in and goes down, but that doesn't really matter. What it means is that's an area you want to put some focus on with some of that roll. Really great way to manage some of that pain. So we are done our mobilization and our stretching exercises. We're now going to get into the strength aspect. Again, we're looking at mainly eccentric exercises. So they are slow lengthening under load of the muscles. The first one, it's called the Peterson squat. You don't really have to worry about the name of it, but all you need again is your first step on your staircase. We don't have a staircase here, so we're going to use this. So Shay's going to step up on this, and we're going to use her right leg so that you guys can see this. What she's going to do is stand a little closer to the edge. She might have to hold me here in case, and if you guys have a railing, that's fine. She's going to stick her left leg out in front, and very slowly to the count of at least 5, bend her right knee until her heel taps the ground, and then come back up. If it's too high, use a little bit of a lower aspect, but again, your stair's about 8 inches, so that should be a decent height. You can make a little box or find a couple pieces of wood, but again, the point of this is she is doing this exceptionally slow. And it's not the standing up part that we're worried about here, it's the way down. You'll notice that she's moving in a smooth, consistent speed. So 1, 2, 3, 4, 5, tap, and back up. If you're using your hand on the railing, you can use the railing to help you back up. We're more concerned with the way down on this one than we are with the way up. So that is one of our best. This exercise can be progressed in a million ways. If you're a runner or a walker, you're really not ever going into much more knee bending than that. So that should be a really good way to go about it. As this gets better, use a higher aspect. So you're reaching further, or simply reach the heel out farther so there's more bend in the knee. Okay? Same thing when we talked about our assessment. We did the one-legged squat to a box. That's the same exercise. I could just lower the box. Right? So it's an easy one to progress, but very important. The next one is for the hamstrings. And there's a big chance that this can be significantly relieving if we are having some knee pain. So what you would likely need with this depends on your surface. If you are on the carpet, something plastic would work well. Furniture sliders would be best. If you're on a harder floor, you want to use some towels, something that slips. So we have these sliders here. We're at a gym. It's a little bit easier for us. She's going to lay flat on her back. What she's going to do is lift her bum all the way up to the ceiling in what we call a bridge. And to the count of at least 5, she's going to straighten out her feet with the sliders. This is not easy. She's feeling all kinds of tension behind her thigh and behind her knee. Okay, you'll notice she's laughing. That's a pretty tough one. So this is probably our easiest way to do some eccentric or loaded lengthening of those hamstrings. So really smooth control on the way down there. Feeling lots of tension behind the thigh and behind the knee. This will fatigue pretty quick. You may find you can't go all the way out. That's okay. This is a decent start. Okay? Let her come up from that before she gets too much of a sweat on. The next one is going to be for the calf. What we're going to do, we don't have your step again is your best spot for this. So Shay's going to use me pretending I'm the railing. She's going to step up on this like as we step. She's going to put her heels off so it's just her toes on there. What she's going to do is come all the way up, and to the count of 5, let those heels drop all the way down below the level point of the step. With a pause, and then back up. So it's just a calf raise or a heel drop. The big thing is that you're doing this loaded with your body weight, and you're controlling that way down. Okay? If this becomes easy, or what I would recommend, is try doing it with a bent knee. So bend both your knees, and keep your knees bent as you do this. This is going to challenge a lot of the other muscles of the calf, not just the great big one that works when the knee is straight. So both of these are necessary. You really want to give them both a try. But if you're trying to improve the mobility of your ankle as well as the strength, you need this in there. It's very easy to do, minimal equipment needed, first stair, hang on to the railing and go to it. We're looking at anywhere between 5 and 20 reps depending on how tough that is. We got one more for you because everybody likes strong hips. What we're going to do is use a band loop or 2 depending on how strong they are. Shay's going to put this band loop around kind of mid-shin area. And she's going to turn and face you guys. We are going to do both angles for this so you can get a look. This is called a banded star excursion. I like to call it an around the clock. Makes a bit more sense to me. What she's going to do is take a semi-squat, so a good athletic position. She's going to load one foot. So I want you to look, there you go. You're going to take this right leg, reach it out, and just tap the floor at 3 o'clock. Good, and bring it back in. And then 4 o'clock, and bring it back in, and 5 o'clock, and back in, and 6 o'clock, and back in, 7 if you want, back in, back to 6, back to 5, let's go 3, let's try 2, let's try 1, let's try midnight, Awesome. So what she's doing here is she's strong and sturdy on one leg, hip, kinetic chain, while the other one is moving. Pretty important if I'm doing any running or walking. Okay? So the band gives you a bit of resistance. You're moving through this relatively slowly and under control. She'll show you from the side here. But a strong athletic stance. Loading one foot fully. So I'm not coming over and planting. She's just tapping with that toe. It's great to turn your favorite song on and do it. Kind of do it to the music if you want. But this is really, really an imperative way to control how you're loading that whole kinetic chain. If you're wobbly on that foot, do this in bare feet. Foot is working, the ankle's working, the knee is nice and stable. So those are our exercises, okay? We've broken them up into our stretches, our mobilizations, and our soft tissue release and foam rolling, as well as our strength or endurance exercises. And again, they mainly take that eccentric focus. Minimal equipment, maximum bang for your buck.